Hi guys, today we will talk about the protective procedures to avoid coronavirus such as wearing of PPE. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. The most common symptoms include fever, dry cough, tiredness. The less common symptoms include aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and rash on skin or discoloration of fingers or toes. The most unserious symptoms are difficulty of breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. The sequence for putting on the personal protective equipment, or the PPE. The type of PPE used will vary based on the level of precautions required, such as standard and contact, droplet or airborne infection, isolation precautions. The procedure of putting on and removing PPE should be tailored to a specific type of PPE. First is the gown. The gown should be fully cover torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten in the back of neck and waist. The mask or the respirator. Secure ties or elastic bands at middle of head and neck. Fit flexible band to nose bridge. Fit snap to face and below chin. Fit check respirator. The third is the goggles or face shield. Place over face and eyes and adjust to fit. The fourth is the glove. Extend to cover the wrist of isolation gown. Use safe work practices to protect yourself and limit the spread of contamination. Keep hands away from face. Limit surface touch. Change glove when torn or heavily contaminated, and perform hand hygiene. How to safely remove personal protective equipment. There are a variety of ways to safely remove PPE without contaminating your clothing, skin, mucous membranes with potentially infectious material. Here is one example. Remove all PPE before exiting the patient room except a respirator if worn. Remove the respirator if leaving the patient room and closing the door. Then remove the PPE in the following sequence. First is the glove. The glove should be outside of gloves are contaminated. If your hands get contaminated during the glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Use a glove hand, brush the palm of the area of the other glove hand and peel off the first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove and wrist and peel off second glove over first glove. Discard the gloves in a waste container. Next is the goggle or face shield. First, outside of the gloves or face shields are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hand or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband or earpiece. If the item is reusable, place in designated receptacle or processing. Otherwise, discard in a waste container. Third is the gown. Gown front and sleeves are contaminated. If your hands get contaminated during the gown removal, immediately wash your hands or use an alcohol-based hand sanitizer. And fasten gown ties. Taking care of sleeves, don't contact your body when reaching 4 times. Pull gown away from neck and shoulders, touching inside of the gown only. Turn gown inside out. Fold or roll into a bundle of discard in a waste container. Fourth is the mask or respirator. Front mask respirator is contaminated. Do not touch. If your hands get contaminated during the mask removal, immediately wash your hands or use an alcohol-based hand sanitizer. Get the button ties of the elastic of the mask, then the ones at the top, and remove without touching the front. Discard in a waste container. And last is wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Perform hand hygiene between steps of hands become contaminated immediately after removing all PPE. So that's all. I hope you have learned something from what I've said. And that's all. Thank you.